Hi everyone, my name is Julianna, and today Daniela and I will be speaking about Generalized Anxiety Disorder, or GAD. Before we begin, we would just like to do a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as X University. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Our agenda for today will include the following: an introduction, what is generalized anxiety disorder, statistics, risk factors, and what are the warning signs. Then I will pass it over to Daniela, who will go over treatment, misconceptions about generalized anxiety disorder, coping with generalized anxiety disorder, supporting someone living with generalized anxiety disorder, supporting a client, resources, and important points to remember. Anxiety from time to time is a normal part of life, but when this anxiety becomes overwhelming and disruptive of your daily life over a long period of time, only then does it become a potential concern and could be an anxiety disorder. People with generalized anxiety disorder often worry excessively and uncontrollably about their daily events and activities. This anxiety is often accompanied by uncomfortable physical symptoms such as fatigue and body aches, and they can also experience trouble sleeping and concentrating. Their worries usually involve thoughts about negative events that might happen in the future and usually begin with a what-if question. Some common questions are, what if I'm stuck in traffic and are late to work? What if my boss then gets upset and fires me? Then what happens if I can't find another job and my friends and family think I'm a failure? People with generalized anxiety disorder usually experience excessive and uncontrollable worry, and this can happen every day, and it is usually very hard or impossible to stop worrying when this happens. Some questions that may help you understand if you have GAD include, do I worry a lot more than others do? Do people tell me that I worry too much? Do I worry even when everything is okay? Do I try to keep busy or distract myself as a way to avoid worry? Is it difficult for me to stop worrying once I start? If you can answer yes to any of these questions, you may have GAD, but it is best to reach out to a doctor or psychiatrist to help you. As previously mentioned, ongoing anxiety and worry that is difficult to control can be a sign of an anxiety disorder, or more specifically, generalized anxiety disorder, or GAD. It is possible to develop GAD at any point in life, and it is often seen in children, teens, and adults. Symptoms of GAD can be similar to those of panic disorder, obsessive-compulsive disorder, and other types of anxiety, but these are all different conditions. In many cases, anxiety often occurs with other anxiety disorders, mood disorders, and mental health conditions such as depression. Generalized anxiety disorder can be a long-term challenge, but it is a treatable disorder that often improves with psychotherapy and/or medication. Along with this, making certain lifestyle changes, learning coping mechanisms, and using relaxation techniques can also help individuals living with GAD. Now we're going to talk about some statistics about anxiety disorders and GAD. Anxiety disorders are the most common mental illness in the USA and affect 40 million adults in the USA alone, age 18 or older. This is about 18.1% of the population each year. Anxiety disorders are highly treatable, yet only 36.9% of those suffering receive treatment. GAD affects 6.8 million adults, or 3.1% of the US population, yet only 43.2% of these people are receiving treatment. Women are twice as likely to be affected as men by GAD. GAD often co-occurs with major depression. In a study of individuals with GAD, the degree of impairment ranged from mild to serious, and an estimated 32.3% had serious impairment, 44.6% had moderate impairment, and 23.1% had mild impairment with their GAD. Like many other mental health disorders, the cause of GAD likely arises from a complex interaction of biological and environmental factors, such as differences in brain chemistry and function, genetics, differences in the way threats are received in the brain and body, and developmental and personality factors. The following risk factors may also increase the risk of an individual developing GAD. Being a woman. Women are diagnosed much more often than men are. Personality. Someone whose temperament is timid, overly negative, or avoids danger may be more prone to GAD than others. Genetics. GAD may run in families just like with any other mental health disorder. As well, life experiences. Many people with GAD may have a history of significant life changes or traumatic or negative experiences that occurred during their childhood or recently. Along with this, it is also thought that chronic medical illnesses or other mental health disorders may also increase an individual's risk of developing GAD. GAD symptoms can vary greatly, but they may include any of the following. Persistent worry about a number of areas that are out of proportion to the impact of the events occurring. Overthinking plans and solutions to all possible worst-case scenario outcomes. Perceiving situations and events as threatening, even when they aren't. Difficulty handling uncertainty. Indecisiveness and fear of making the wrong decision. Inability to set aside or let go of a worry. Inability to relax, feeling restless and feeling keyed up or on edge, and difficulty concentrating or the feeling that your mind goes blank. Physical symptoms can include the following: fatigue, insomnia, body aches, trembling, nervousness or being startled easily, sweating, rapid heart rate, nausea, diarrhea or irritable bowel syndrome, and irritability. Symptoms in children and teens can also be a little bit different, and these include overly anxious to fit in, being a perfectionist, redoing tasks because they are not perfect, spending excessive time on homework, lacking confidence, striving for approval, requiring a lot of reassurance, especially with schoolwork, avoiding going to school or social activities, and excessive worry about the following: their performance at school or sporting events, their family members' health and safety, punctuality, and catastrophic events.
Now we will discuss some treatment options. Treatment is dependent on how the mental illness is impacting someone's life and their ability to function. There are two treatment options generally used: medication and psychotherapy. Sometimes a combination of both will be utilized. There are different types of medications used in the treatment of generalized anxiety disorder. It is important to discuss the risks, side effects, and benefits with a professional. The first medication to typically be prescribed is antidepressants, such as selective serotonin reuptake inhibitors, or SSRIs, or serotonin and norepinephrine reuptake inhibitors, or SNRIs. It is important to know that it may take a few tries to find the right medication and dose that works for you. There is also Busiprone. This is an anti-anxiety medication that can be prescribed for continued use, and similar to antidepressants, it will take several weeks to fully work. And finally, there are benzodiazepines. While more rarely prescribed, occasionally these will be offered by a professional for anxiety. They can only be used for a short period of time and can become habit-forming. It is important that this medication is not used if there is history of drug or alcohol misuse and abuse. Another treatment option is psychotherapy, which requires an individual to work with a professional with the intention of minimizing symptoms. Most commonly used is cognitive behavioral therapy, or CBT. It will provide skills and tools to manage anxiety as well as work on avoidant behaviors. With either of these treatments, it is significant to know that it will take time to see improvements in symptoms. There are several misconceptions that exist about generalized anxiety disorder. These misconceptions give rise to stereotypes and perpetuate stigma about the mental illness. Because of this, while it is a common mental illness, many people avoid treatment or speaking up about their experiences with anxiety. It is important that we discuss misconceptions so that we can work on deconstructing them and our own biases. The first misconception we will look at is anxiety is the same thing as worrying. Worrying and anxiety are two different things. Worrying is temporary, while generalized anxiety disorder is a mental illness that can have long-lasting impacts on individuals. The next misconception is anxiety medications are all addictive and should be avoided. Not all anxiety medications are addictive, and the most commonly prescribed ones are safe and have minimal side effects. While benzodiazepines can be addictive, they are only prescribed short-term and are not the first medication that a doctor will prescribe. People living with anxiety are weak. People living with a generalized anxiety disorder are not weak, and many individuals, including those living with the condition, believe this misconception that anxiety is equivalent to weakness. This misconception perpetuates many harmful stereotypes and stigmas and can lead to underdiagnosis of the condition. And finally, anxiety will disappear if someone has a healthier lifestyle. Living healthy can help someone cope with anxiety, however, it is not a cure. This leads to the belief that anxiety is not worth treatment or professional support, and can result in individuals avoiding treatment. There are different ways that someone can go about coping with generalized anxiety disorder. Not all of these methods will work for everyone, but they can be a great foundation for coping with the mental illness. We will discuss 3 different types of coping strategies and specific coping methods for each. The first coping strategy is social coping. This can be beneficial for some people as they diminish some avoidant behaviors and can help to work on someone's social life. It is especially important as this mental illness can lead to people isolating themselves from others. Some ways to do this include finding events that you can participate in to get involved, or reaching out to a trusted individual to discuss your anxiety. Another strategy for coping is emotional coping, which can be beneficial in managing intrusive thoughts and feelings of being overwhelmed. Specific techniques can be mindfulness and understanding what triggers your anxiety so that you can work on this. And finally, physical coping can be beneficial in managing anxiety, as it is important that individuals look after their physical well-being. This includes ensuring you eat enough, adding exercise into your routine, and getting enough sleep. There are various ways to support someone living with generalized anxiety disorder, and it is important to know that the ways of supporting someone may change depending on individual needs. It can be important to listen to someone living with GAD. While listening seems like an obvious way to support someone, it's important to actively listen and ensure you validate their feelings. You can also learn about the mental illness. Learning about GAD can be beneficial as it can help to provide you with a list of expectations and can assist in deconstructing any stigmas or biases you may not realize you have. It is also significant to avoid minimizing their lived experiences. It's important to avoid phrases such as "it's not much to worry about" or "there's no need to be anxious." While the intention may be to reassure the individual that they are in a safe environment, it can lead to self-doubt. It can be more beneficial to ask what they need. You can also encourage self-care and treatment. Helping someone seek treatment can be beneficial, and reminding them to take care of themselves can also be helpful. While it is important to support someone, it is also important to look after yourself. Establishing boundaries and reaching out to someone can help you practice self-care. Supporting a client. There are many different tools and strategies that can be provided to clients to help them manage their anxiety. First, you can help them to understand what they can control and what is out of their control. This can assist them to challenge negative thinking and their need to control to help their feelings of anxiety. You can also encourage them to journal for anxious thinking. Having clients journal and write down their negative thoughts can be a helpful way to have them challenge their thinking and negative thinking patterns associated with anxiety. You can also encourage clients to move when they're feeling anxious. This will act as a distraction, and the exercise can help regulate their breathing. Or you can educate clients on the correlation between lifestyle choices and anxiety. You can let them know while a healthy lifestyle is not a cure, it can be beneficial for managing their anxiety. It is also important to remind them that while unpleasant, anxiety and feelings of anxiety are not dangerous. Now we'll go over resources. The most important thing to take away from this video is that there are supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. We will conclude this video with some important points to remember. Anxiety from time to time is a normal part of life, but when this anxiety becomes overwhelming or disruptive to daily life over a long period of time, only then does it become a concern and could be an anxiety disorder. Generalized anxiety disorder, or GAD, is ongoing anxiety and worry that is difficult to control. The cause of GAD likely arises from a complex interaction of biological and environmental factors, such as differences in brain chemistry and function, genetics, differences in the way threats are perceived, and developmental or personality factors. There are different warning signs such as physical symptoms, as well there are differences in symptoms for children and teens. We will continue with some important points to remember. There are treatment options for GAD, including medication, psychotherapy, or a combination of the two. Misconceptions about the mental illness are important to deconstruct as they perpetuate stereotypes and stigmas and can lead to the underdiagnosis of the mental illness. There are various ways of coping with GAD that can be classified into 3 types, such as social, emotional, or physical coping. As well, there are ways that someone can support an individual living with GAD, but it is equally important that they look after themselves. Practitioners can provide helpful tools and techniques to help clients cope and manage their anxiety. Finally, it is important to remember, while unpleasant, anxiety cannot harm and is not dangerous. That concludes this video on generalized anxiety disorder. Thank you for watching.